The U.S. state of Idaho has been told by a federal court it must pay for gender reassignment surgery for a transgender inmate. Unless there's a successful appeal in the Supreme Court in the next 90 days, it will be the first time a state has been instructed to pay for such a procedure.
Since the medically necessary treatment for a prisoner's gender dysphoria is gender confirmation surgery, and responsible prison officials deny such treatment with full awareness of the prisoner's suffering, those officials violate the Eighth Amendment's prohibition on cruel and unusual punishment.
Well, the inmate, who identifies as a woman but hasn't yet undergone the surgery, is Adree Edmo. He's serving a 10-year prison service sentence right now for sexually abusing a 15-year-old. Edmo is scheduled for release in 2021 and is not eligible for parole. But if the gender reassignment surgery is successful, paid for by the state, Edmo will be transferred to a women's prison. We asked two commentators in the US for their thoughts on this case then.
I absolutely don't think that taxpayers should be funding people's preferences. There is absolutely zero evidence in the medical community that gender dysphoria is in any way solved or even helped for people, who are confused about their gender. There's nothing that says that that changing their gender will actually help them psychologically, physically, or in any other way. And when you think about the fact that that taxpayer money could be going toward helping other victims, like the 15-year-old that this perpetrator violated, that's where I start to get really angry.
Well, she is in prison. I say the state is responsible for that person's health and welfare. So, yes, it should be covered, just like cancer treatments are covered, just as any other treatments, I'll say medical conditions are covered in American prison systems. The Constitution is quite clear that, and several cases have proven it in terms of transgender inmates are to be taken care of. Failure to do so is a violation of the Eighth Amendment of the Constitution, and it's clear. That's that.
This is an incredibly sad testimony to the dangers and the damage of politically correct thinking and, frankly, indoctrination that is happening in media really globally, not just in the United States. So I really hope that people can get their sense about them and look at the data, because, as I said, there is no medical consensus whatsoever that this will even be any help to this prisoner, to this offender. Even if they go through with the sex change, their suicide rates are higher, their self-harm rates are higher, their depression rates are higher, their need for medication is higher, their likelihood of recommitting crimes is higher.
There is only one cure for, gender dysphoria. That is surgery. The bottom line is, okay, let's get off of this narrative where you're trying to demonize trans folks here. Because there are non-transgender folks who are also abusive to minors as well. So let's get away from that period, because far too often transgender people are demonized, not only in this country, but elsewhere around the planet.
This is more about a political opinion and a political preference that has become sort of popular at this moment, but it's doing a great deal of destruction to the LGBTQ community, certainly to our prison systems, certainly to our courts, and certainly to our victims.